So physical medicine and rehabilitation, it's a specialty that's non-surgical that focuses on restoring movement and function to people who've been injured. This injury could be neuromuscular or musculoskeletal, but what really appealed to me was the orthopedic segment of my training, where I learned about the spine and the large joints, hips, knees, and shoulders, and how we could restore function to injuries to these areas. We have a wide variety of options for patients, whether it's non-interventional, trying to find the right therapy or maybe the right type of medicine that could reduce inflammation or muscle spasm. But we also have interventions, procedures that are non-surgical, finding out the exact pain generator and guiding a needle or medicine to it is really relieving for patients to hear, because it's something that they can get relief from without surgery. I believe that you have to listen to the patient. You got to hear their story, and I think you can get a lot of information. In fact, most of what you need to know in the discussion. Well, after I establish a diagnosis, typically either through an examination or a discussion with the patient or diagnostics, we'll hone in on that injury. Treatments would include the right type of physical therapy, or a home exercise program, or the right type of medication. But we'll treat patients with spinal issues, so a pinched nerve, a herniated disc, arthritis of the spine, so we could use cortisone injections. Sometimes these are just performed in the office. So I believe that the encounter with the patient experience is bigger than what happens within the walls of the exam room. I really have a lot of faith and trust in the staff around me and my partners. And so knowing that what I'm going to implement with the patient in the exam room is going to be completed outside is really reassuring and comforting.